Hey everybody, what's up? It's Nicole. Welcome back to my channel. So I am just cleaning the house and getting everything taken care of because I like to do that on the weekends, just clean, and then on Sundays I can relax, and then on Mondays I go back to work. So I wanted to talk to you guys today. I wanted to do a special video dedicated to mental health and addiction. And I want to share with you guys some experiences I have, and I also want to share with you guys some experiences that my friends have, and I want to talk about how important it is to make sure that we maintain our mental health if we struggle with mental illness. And if you even have to ask yourself, do I have a mental illness? Then you need to go get checked out. You need to go to the doctor. Because if you have to question yourself, then you might have a mental illness. So, I struggle with depression and anxiety. My anxiety is brought on by fear. Fear of the unknown, fear of what other people are doing when they're driving their vehicles. I have a very bad, huge fear of driving on the interstate. So much that I will not drive my vehicle to see my parents. My husband has to drive. And if I do drive, I will literally have a panic attack. So I don't drive. The only time I drive is in my city, on the side roads and stuff. Like, I take the long way everywhere, you guys. I'm serious. And so it's such a strong fear of mine that I have tried to overcome it for years and years and years. And I'm getting better, but I still haven't overcome it. And then I have I have depression, not severe depression, but just depression, clinical depression. The doctor diagnosed me when I was about 16, 17 years old, and I've been on some kind of antidepressant ever since. I am currently on Lexapro and Wellbutrin, and those things have been working out pretty well for me. I'm actually tapering off the Lexapro and just going to continue on the Wellbutrin, because the Wellbutrin is what I really notice helps me out the most. I have been working hard trying to zero in and target and see where I start struggling the most and what's happening when I'm struggling. And so I know that my anxiety is brought on by the fear of the unknown. And so I've pretty much got my anxiety in check. Now, there will be some instances, like when I'm at work and maybe my boss comes and I'm worried or anxious about, me not doing a good enough job, and that's because sometimes I'm unsure of myself. But it's nothing I can't handle. And my depression, like I said, I take medication for that, and it comes and goes. It comes in waves, even though I'm on medication. But the way that I fight my depression is I try to go against what my mind tells me. A lot of the times when I'm in a depressed state of mind, my mind will tell me not to get up, to stay in bed, to just be in the bed, thinking. And that's when I start going in my mind and thinking about all the things that I haven't done and all the things that I feel like I lost out on because of my addiction. And I have worked really hard with my therapist to learn how to work myself through that thinking onto the other side. Mental illness and addiction can go hand in hand, and it usually does for a lot of people, because as addicts and alcoholics, we self-medicate ourselves when we're feeling our depression, or we're feeling anxiety, or we're feeling sadness. Any feelings that make us feel that we don't like to feel, we try to cover up with drugs and alcohol. So when I was younger, I used drugs and alcohol a lot of the times to cope with not feeling like I fit in, not feeling like I was a part of. And the drugs and the alcohol gave me that superwoman feeling, like I was the coolest girl and the prettiest cheerleader and the best basketball player, and drugs gave me confidence, a false sense of confidence. And that's what it is. Now I realize that it was a false sense of confidence. But just because I'm on medication and I've gotten to a place in my life and in my mind where I can work through a lot of my issues, it doesn't mean that I stop going to therapy. It doesn't mean that I'm going to stop taking my medication. It doesn't mean that I'm not going to follow through. I think what happens to a lot of us addicts and alcoholics is we start feeling better, and then we stop taking action. We stop following through with our treatments that we have for our depression and our anxiety. And we stop taking the medications because we feel better, and we don't ever attribute to that. We might feel better because we are taking our medication as prescribed, and we're taking action and doing the things that we have to do, like therapy, talking to others, working with another alcoholic or addict, exercise, journaling, all these activities that we do that help us. And when we get sober and we start feeling a lot better, then we stop doing the things that were helping us. You know what I'm saying? So, and then also, when we're in our active addiction, there's no way to tell if what we're experiencing is either from our addiction or if it's a mental illness, because our brains have, all this different medication in them, and we're doing drugs. And so the best time to get evaluated for that is with your doctor, and after you've been sober for about a year, the doctor can really, get in and evaluate you and see if, like, the things that you were experiencing were just side effects of the drugs and the alcohol. Then he'll be able to differentiate, maybe even 6 months. But the most important thing is that if you struggle, you guys, with mental illness, there's nothing to be ashamed of if you have a mental illness. We all struggle. Almost everybody I know struggles with some kind of depression, at least, And then I have a lot of friends that are bipolar, and manic depressive. My sister's bipolar. She has antisocial personality disorder. She has schizophrenia, like a slight kind of form of it or something. And then my little nephew has Asperger's syndrome, and they're all perfect. My sister, she steadily goes to therapy. She's been going to therapy all her life, and she will not stop. It helps her so much. And if she does stop, I can tell, and I always ask, have you been going to therapy? Yeah, I got to get back on track. You guys, we cannot stop these things that we do to work on ourselves. This is a forever process. The journey into recovery is a forever process. There's no finish line. You're not going to get sober and then get your mental illness in check and then stop taking everything because you're finished and you're cured. It's a process. It's a journey. There's no destination. I want to encourage you guys, like, if you're struggling with depression and anxiety or any type of mental illness, schizophrenia, bipolar, DID, agoraphobia, all these things that I know a couple of you guys struggle with, if you're struggling with those, you need to make sure that you're doing a treatment regimen, that you are seeing your doctor regularly, taking part in therapy, and taking your medication as prescribed. When you're about to get your medication refilled, make sure that you call it in on time and you don't skip doses. Yeah, baby. And make sure that you're following through with your therapy, you guys. It's just really important. Because here on my channel, I'm not a doctor. And I can help you and talk with you as much as I want, but it's not the same as what your therapist or doctor is going to be able to do. So I just wanted to make this video because I feel like it's really, really important. If you're an addict and you struggle with mental illness, please take action, follow through, and keep up with your treatment. Do not isolate. Do not hide out. Get your butt to the doctor, get your butt enrolled in some therapy, and get your butt on some medicine that helps you with your mental illness, and stay with it. You guys, I remember when my anxiety and depression was really bad, and I would do the same thing. I would start feeling better, and then I'd say, I don't need these pills anymore, and I'd throw them away, and then I would have another downward, whew, got worse, now I need them again. Like, we have to just stay on track. We have to stay consistent, which is, so when not, same with your recovery. Consistency is key. Following through is key. Yeah, so there's no shame. Mental illness, there's no shame in it, you guys. No shame. So I love you guys so much. If you guys want to share with me, if you have a mental illness and you have found things that work for you, that you're doing that help you with your mental illness, comment down below and let me know, so that way other viewers will know, and maybe they can get some tips that you guys are doing to help you through your days. Okay, guys, I love you, and I hope you have a great day.